Assalamu alaikum and good evening to all our viewers. I am Diva Mumtaz from IUST Alumni Council and I welcome you to yet another discussion organized by the Council. Due to the prevailing situation and the onset of COVID 19, there has been a slight disruption in the frequency of the programs. However, as the whole world is slowly regaining momentum, so are we as a team. I hope that all of you, all the students, alumni, and faculty members are healthy and safe. The Valley of Kashmir has been under political turmoil for decades, which imposes an enduring psychological impact on the people. The political disturbance, economical degradation, and recent onset of COVID has highly affected the mental health of the people, especially the youth. One of the studies has found that about 45% of Kashmir's adult population was suffering from some form of mental distress. There is a high prevalence of depression, anxiety, and post traumatic distress among the people. Further, there are just a few hospitals that are available in the valley. While there has been a lot of work done in mental health in the West, there's still a lot of work to be done in East, especially in the Valley of Kashmir. Given such situation, it is very important to highlight the issues related to mental health and well-being. Thus, we selected the topic of today's discussion as towards mental wellness of the youth of Kashmir, with special focus on the challenges and responsibilities. Joining me is Arif Aslam, who is also an alumnus of IUST, and he will be hosting the discussion today with me. Arif, please introduce the eminent guest for the discussion today.
Thank you, Diba, for the introduction. Assalamu alaikum, everybody. So we will be continuing today's discussion. And before we start, I will be giving a short introduction of our guests. So we are joined from London by Dr. Shaheen Aslam Shora. She is a psychiatrist and the clinical director of mental health services. She is a tutor, mentor, and researcher at the Regional Royal Society of Medicine, London. Dr. Shaheen is passionate about public health and well-being, promoting healthy living and empowerment of patients and the public. She works for humanitarian causes and believes in equality and fair chance for all. Also joining us today is Adil Shah. Adil is currently a student of computer science and engineering at IUST. And more specifically, he is the president of the Student Council Committee at the IUST. Also joining us shortly would be Dr. Nazir Ahmed Zargar. Dr. Zargar is an assistant professor at the Central University of Kashmir in the Department of Religious Studies. He has done his master's in Islamic Studies and was awarded gold medal and a certificate of distinction from the University of Kashmir for his outstanding performance in the Islamic Studies. Dr. Zargar was awarded MPhil in 2003 on Dawa methodology in the contemporary perspective and PhD on Islamic perspective on peace and justice. He has delivered a number of lectures to college and university teachers covering the topics including Quran and science with special reference to mathematics, administrative ethics, ethics in police administration, and concept and categories of knowledge. So that was about our guests. So to begin with, I would like to start with Dr. Shaheen. Dr. Shaheen, all of us understand physical health in terms of musculature, BMI, weight, etc. Well, mental health, although equally important, has often been neglected, mainly because of lack of awareness and in some cases even for the lack of acknowledgement. While researching for today's discussion, I came across the term DSM, which I was not familiar with, which stands for the Diagnostic and Statistical Manual, which is used by psychologists and psychiatrists all over the world to identify the characteristics of different psychological disorders. Sorry. So, since I consider myself fairly, well-read, and a lot of my peers I discussed with had no idea about this. So, prima facie, it means that a lot of work has to be done for mental disorders and their understanding thereof. So, what I would want to understand from you, from a very elementary point of view, what mental health actually stands for. What are its causes, what affects it, and how to go about it in details.
Assalamu alaikum, everyone. Thank you very much to Alumni Council for inviting me today. Thank you, Deepa and Areeb, for the introduction. So, as you both did touch upon the fact that mental health, in comparison to West and the East, we are still far, far behind in the East. And it really starts with our awareness of knowing what mental health is. So, the awareness with regards to physical health is much more common. People are generally well versed with it, but in terms of mental health and mental well being, the awareness is far less. And there are historical reasons for this because mental illness was always stigmatized. It wasn't seen something that people would openly talk about or discuss. And gradually that stigma has faded, and the people in the world have come to realize that mental health is as significant as physical health. So, if I just give you a very basic introduction in terms of what mental health is. So, if we look at the World Health Organization, which is the WHO, their definition of mental health, it's a state of well being in which an individual realizes his or her abilities. They can cope with normal stresses of life. They can work and they will be able to contribute both effectively, productively, and they also are able to make a contribution within their community, wherever they are living. If you break it down, it covers, various different aspects of how you could define mental health. In terms of breaking it down further, for laymen, but also for our audience, mental health comprises of both emotional, psychological, and social well-being. So all three aspects are very important. It also determines how we feel about ourselves, about people around us, about the world around us, and thereby how we will act. So our actions, our behaviors are determined by how we feel and think about, the environment around us, about others. I think somebody's microphone may be on because there's a little bit of rattling. So if we kindly switch those that are on off, please, while I'm speaking. Thank you. Mental health also determines how we will be able to cope with stress. So, human life is such that it's impossible to think that we will have a smooth sailing from the time of birth, till we live and die. That's just an unrealistic proposition. Stresses come in life, and mental health teaches us or gives us that ability to be able to handle the stress and to be able to handle the ups and downs of life. Mental health will also help you relate to others and it will also help you to make choices. So, choices have to be appropriate, whether you're making a decision with regards to, for example, what course you want to study, whether you're making a decision who you would like to marry, whether you want to decide which field you want to specialize in. If your mental health and your mental state is in a good state, then you are able to make better choices and better informed decisions. Obviously, you will need some help from others to do that. Many a times, it could be your elders, it could be your, counselors, career counselors. If it's life choices, you would depend a lot on your parents and your family. So, at every stage of your life, right from the time you are born, your childhood, your adolescence, all the different aspects and all the different times of your life, your mental health is significantly important. And I want to convey this message with a lot of significance that it's extremely important to understand and realize that. Now, Reeb, you did touch upon DSM and in terms of the classification of mental illness. In Europe and in England, we use a different classification. So DSM is generally used in America, in Canada, and in the UAE side of the world. In Europe and in England, we tend to use what's called the ICD-10 classification. So it's International Classification of Disease. That's the mental health classification of diseases that we use. And soon we'll have the ICD-11 out. So there is an upgrade to it every few years. Now, if I talk about the main mental illnesses, I'll broadly classify them into 4 different categories. So we have psychotic illnesses, which are quite a disabling condition. There's a lot of morbidity with these conditions. And under these psychotic illness, we have things like schizophrenia, psychotic illnesses, delusional disorders, persecutory disorders. So these come under psychotic illnesses. Then we have what's called depressive disorders, and depressive disorders are quite common. And under these come depression, anxiety, bipolar affective disorders, and depressive illnesses tend to be quite common. So about 1 in 4 of us, of adult population in the world, at some point in their life, they will suffer with a depressive disorder or some sort of a depressive illness. Then we've got another classification, which is called personality disorders. We won't go into the details of that at the moment, but if you wish me to go through it later, I can do that. And then there is another broader group, which is called organic disorders. And by organic, it means that it's got something to do with the brain. It's basically neurodegenerative. So under these come dementias, cognitive impairments, brain injuries, and the rest. And obviously, then there is the drug and alcohol or substance misuse, which is another category. And parallel to that is our eating disorders. So these are sort of broad classifications that I have spoken about. Would you like me to continue, or do you think this answers the question you asked me, Arif, for now?
I think for the purpose of introductions, we have some idea, and going forward into discussion, I think we will deliberate on it more. So for now, I think we have a basic idea of what we are talking about, basically.
Okay, thank you.
So I would now like to move on to Dr. Zerger. If he's joined, yeah, but he's muted. So Dr. Zerger, my question for you specifically, given that your background is from the Islamic studies, we wanted to consider the Islamic perspective on the mental health aspect of life. So, given that we often come across the Quranic verse, فَإِنَّمَا الْعُسْرِ يُسْرًا إِنَّمَا الْعُسْرِ يُسْرًا. Verily, after every hardship, there is relief, and it repeats after that after every hardship there is relief. So there must be a reason as to why this was repeated twice in the surah. All right. Also, again, in that while researching for the topic, I came across from the Quranic point of view, in the Battle of Uhud, where the Muslims suffered amazing and incredible amount of loss. But in the following verses, I'll just read quickly the translations. Allah Ta'ala farmate hain, so do not weaken and do not grieve, and you will be superior if you are true believers. And not only this, in the next verse, he goes on to say that he turns the loss into something positive. The next verse says that if a wound should touch you, it has already touched the opposing people in a similar way. And these are of the days are of varying conditions, which we alternate among people. So it's like if you don't have a good, a good day has to be followed by a bad day, and a bad day has to be followed by a good day. So, speaking strictly about from the Islamic point of view, what do we know of the mental health and its details and stuff?
Thank you so much. Bismillahirrahmanirrahim. Assalamu alaikum. As for the Quranic injunctions and teachings in this respect are concerned, I would like to suffice my answer around only one ayah of the Holy Quran and some of the traditions of Nabi Kareem Sallallahu Alaihi Wasallam. You see, our life is full of sufferings, and sufferings and failures, and so many things are a part of our life. But how does the Quran teach you how to keep hope and don't get disappointed? Allah Ta'ala says that عسى أن تكرهوا شيئا وهو خير لكم وعسى أن تحبوا عسى أن تحبوا شيئا وهو شر لكم وعسى أن تكرهوا شيئا وهو خير لكم والله يعلم وأنتم تعلمون. At many times you think that something is not good for you, but there can be good in this, because you don't know uh, how good can come into your life. You should hope for the best. Number two, Nabi alayhi salatu wasalam, according to the teachings of the Quran, has taught his community to have firm faith in taqdeer, in qadr, predestination. Whatever has been is being coming into your life is according to the predestination, what has been destined by Allah subhanahu wa ta'ala. You have to do good, but if the result is not in your favor, then keep faith and then have positive thinking that something good may be in this. Allah Ta'ala has his own ways of doing things with his servants, with ibadullah. So many things which you feel that they are not good for you in the future, they can be good for you, because blessings come in disguise very often. That's why patience has been commanded. Allah Ta'ala oftenly in the Quran, and you will find in the tradition of Nabi Kareem Sallallahu Alaihi Wasallam, the Sabirun, those who are patient, those who don't lose hope, they are highly praised in the Quran. You see, Allah Ta'ala says in the Quran that innal insana khuliqa halu'a idha massahu sharru jazu'a wa idha massahu al-khairu manu'a illa al-musallin. Man has been created as if something he does things in haste, and he wants to get the result of things in haste. So he very quickly loses hope when he gets enmeshed into desperation and all those things. So Allah Ta'ala says this is the nature of the man. Whenever some misfortune falls on him, he loses hope, and when some good comes to him, he gets so much highly uh, encouraged that he sometimes loses sight of Allah Ta'ala and His commandments. Illa al-musallin. But this doesn't happen with those who are well grounded in salah, who are well connected with their Lord through salah, through namaz, through prayer. So when they pray, they don't lose hope in the situations of desperation, and they don't become boastful in the situations of happiness and joy. So this balances their approach. So the Quran has now, our mind should be grounded in taqdeer, predestination, and our actions and behavior should be that we must hope for the best but be prepared for the worst. That's how the Quran and the Sunnah teach the man how to deal with the situations when they come into your mind. I hope I have tried to just deal with
Yes,
your
sir.
question. If you allow me to say something more, I just take into consideration the paucity of the time. That's what.
Yes, sir. So very well said that during the life we face a lot of challenges, and at some time we feel very depressed and we just lose hope. Except especially these, there are a lot of challenges, there are a lot of opportunities coming in our way, and there is slight misfortune and we just lose hope. So at those times, it is important that we hold on to our faith, and we know that this is a time and it will pass. So thank you so much, sir. Now my next question is to Adil. Adil, being a youth, being a part of this generation, and also being a president of a student body, you must have experienced that there are many students or many youngsters who come to you with a lot of anxiety related issues, or who have issues related to their mental health. So, what are the issues that the current youth, especially of Kashmir, are facing?
Assalamu alaikum, everyone. Thank you, Mar, for having me here today. And the answer to the question is yes. In the past couple of years, I have been in IUST and to the other places. I came across a lot of youth that I've interacted with. Moreover, to the people or to the students of my own university. So I guess there are three to four, five more main things that I can classify into that students broadly say. One term that they say is depression. Second term that I have heard most is anxiety. Third is societal thoughts. One more is that is overeating, eating disorder, and the last one is addiction. These are the five main overall things that are affecting the mental health of the students and to the youth. And that is now the biggest challenge for the organizations or institutions like Islamic University right now to help those students who are in need. For example, there was a student in our university, she wanted to start a mental health group, but when she came to me, I told her that you can do it on your own, but there was nothing like that in the university. Foremost, that as in society we just need to understand that mental health is just like another health. We have physical health, we have mental health. And when you talk about mental illness, it is something that is hampering your functionality that you want to do day-to-day life. And what institutions can do, specifically what as an institution Islamic University can do. The important question that we must ask is, firstly, is mental health of the students important? If the answer comes yes, then the second important question that we need to ask is why it is important. If we are saying it is important, why? So if we found the second answer, then the third important and most important is how we can help it, how we can achieve the mental health, how we can help the students who are in need. And the first and foremost important thing is there must be a mental health counselor in every institution, whether no matter whatever the level is, it's of 10th grade, 12th grade, 11th, university, somebody is doing PhD or anything, or any college. Mental health counselor must be there. There must be a separate section that deals with such things. And why students or why the youth feels that there's a problem with them when they talk about mental health, or why it is disrupting them, is they don't feel that they are inclusive in that organization. For example, when we have a lot of students and you see that every year millions of students get their degrees by any means, and is a whole new institution, and it has a lot of chaos going in and around. And moreover, there are students that have diverse needs and interests, and when they have problems and when they face difficulties, they don't feel inclusive. They feel that they are neglected, they are not treated well. This is the problem that lead to then other disorders like addiction, and like they get suicidal tendencies. Nowadays we are seeing more suicides are happening. That is, I guess, one of the reasons that that's there. And yes, I guess that answers your question.
Thank you, Adil. I would like to ask Dr. Shaheen. पहले क्या होता था कि पुरानी जनरेशन, हमारे पेरेंट्स वगैरह, वो लोग ये बोलते थे कि कह नहीं परवाए, कोई बात नहीं, ये आसान टेंशन ज़्यादा गैस सानुन, या तमिश टेंशन गोमत, या तो ये ज़्यादा सोचान, यूता छन आसान सोचन. तो ये वाली चीज़ें, डू यू थिंक कि मेंटल हेल्थ जो है, ये पहले भी देयर वाज दिस प्रॉब्लम, या अब बिकॉज इट इज़ बीइंग हाईलाइटेड अब ये प्रॉब्लम है? क्या पहले भी ये प्रॉब्लम्स थी या नहीं थी? What do you think? What is the difference between the earlier generation and the new generation?
Thank you, Deepa. It's a very interesting question. So mental illness is not new per se. Mental illness was always there as far as we can think. But what has changed is that the way people live life now is very different to say how, as you said, our parents, our grandparents lived life. So things were much simpler. There was less competition for things. There were less stressful situations in terms of expectations. What's expected of you? What do you expect from the world? There was more satisfaction in things that were not worldly, that were not necessarily materialistic. But as we have moved and modernized, all of these situations in a way have changed. So the environment we live in has changed. What's expected of us has changed. Population has increased exponentially, which means that for the same job, for example, if 50 years ago there would be 3 people competing for a job, it's like 300 now. So you're putting a lot of pressure on population and generally on people, on students, on youth. The other thing that has also changed, for example, as we are live now, through internet, there is a lot of information available that anyone can easily access through their smartphones, through their iPads, through their gadgets. So when there is more access to information, you will tend to delve a lot more on things that previously you weren't necessarily as aware of. And also, if we speak about just the last 1 year, the COVID-19 pandemic has in itself added another layer to the ever-changing world that, as I have mentioned, a lot has changed. In terms of, if we look at Kashmir itself, because obviously, the program is focusing on the youth of Kashmir, we shouldn't forget, as you mentioned in your introduction, we are the world's most militarized zone, which means that there is a tendency of living in an environment where there is uncertainty, where there is fear, where you can have feelings of anxiety, paranoia, persecution, much more commonly in contrast to somewhere which was conflict free. Similarly, if we take COVID-19, it's a very unusual situation because people are or were socially isolated. There's a disruption of the routine. There is no structure available in terms of regular schooling. There are very little recreational facilities. So you are not able to focus or spend your energy and your talent and your abilities in a constructive way as you would, say, prior to the pandemic. The other thing that we need to bear in mind, our social way of living has also changed. So from being joint families where you would share your difficulties, you would share your burdens, you would share housework, there would be a lot of support, say, from grandparents, from your uncles, aunties or cousins. All of that, as time has gone on, has become very changeable, and we are very nuclear families now. And it's a very busy nuclear family where usually both parents are working, in contrast to, say, 50 years ago, where your mother was at home. For example, my own mother, she didn't work. She was educated, but she, chose to look after the house, bring up 4 children. And we always had mom present when we came back from school, for example. She was always there, whereas children now depend a lot on someone else, a helper, or mom is not always as present because she's herself busy. So that's changed as well. I think the other thing that has also happened is that we don't necessarily have as much confidence or as much affiliation to what were the protective factors previously, like your faith, like Dr. Nazir Sahab said, a belief that you are predestined to have something, which is taqdeer, but then you have tawakkul, which means that you have that belief that even if there are difficulties, I will overcome them. And we have less and less of these central strengths that really you have within yourself. So these are few of the reasons that I can think of. But I think what has changed the balance significantly is this access to information and the internet that's so easily available. But at the same time, the downside or the unfortunate side in Kashmir is that we do have access to information, but we may not have access to useful information. So it's not filtered. Similarly, we don't necessarily have, as Adil was saying, in our educational institutions, although times have moved on, we don't incorporate mental health awareness in our syllabus, as children are growing up, which again is something very different to the West, where you are taught about your mental well-being. You are exposed to how you may feel if you struggle mentally or you become mentally unwell from a very early age. So you are made aware with information that is useful. And you have lots of support systems in place, which unfortunately we don't have as many available in Kashmir. But having said that, I think in the last few years, a lot of support has been put in place through your psychiatric services there, through the non-governmental organizations, and they do excellent work as best as they can within the given resources. But I think again the challenge is that they are starting from a scratch, and it's very difficult initially with any type of work that you do, that it takes quite a while to get started. I can explain it in Urdu as well, because there was a comment previously to say, we didn't need to speak in English. I think I would even prefer to speak in Kashmiri to say कि अस पज़ ये ख्याल थवुन कि सानिन गरन मंज क्या छु गसान अस छु आसान पाई छन आसान कि सैन बच्चे क्या छु करान अस छु समझान तिम छु शायद ऑनलाइन क्लास अटेंड करान या तिम गई नबर दोस्तन सतन अस छु आसान ये पाई कि इहंदिस जहनस मंज क्या छु गसान यमन मा छु का मुश्किलात यस इहंदिस जहनस मंज छु या यम मा छु का सु चीज करान युस इहंदिस जहनी सेहतस आजार वातनाय या इहंदिस फिजिकल हेल्थस खराब करे इसलिए ये मे गुजारिश कि यम सन वालिदैन छि तिमन ते पज होशियार रोजुन तो तिमन ते पज ये वनुन कि यह बल बल टेंशन तुम मे हेव टेंशन मगर क्या पज तिमन कर तिमन पज बच्चन सत बिहुन तिमन पृछुन तुम वनियो अस क्या टेंशन छु so that you are able to express and have these very open, honest conversations. But you need to create that environment of confidence that your children will confide in you and they won't go and make use of something to cope, which actually will be detrimental. For example, illicit drugs. I hope I've answered your question, Deepa, but if there's more you want me to add, then I can.
Thank you, Dr. Shine. I think that was pretty clear about what the responsibilities should be for people. मेरा अगला सवाल डॉक्टर साहब से है. डॉक्टर साहब, since you are in an educational institute, you're part of an educational institute, what do you think should be the role of universities vis-a-vis mental health? आपको क्या लगता है कि क्या करना चाहिए university को as an institution, because this is something that can be institutionalized. I would later ask the same question to Adil. Okay, you being from the teaching fraternity, you have a different approach of things, and Adil probably has a different approach on things. So, if you could quickly both of you answer, okay, role of universities or education institutions with regard to mental health of students.
Should I answer first?
Yeah. Yes,
go ahead.
Since time is very short, I would just point only one thing about our examination system, which has now overburdened the students. So just an examination after 2 months, and examination after 2 months, and just the examination is coming. So examination after examination has overburdened the students. And you know the situation now, as your sister was telling you about the COVID, unusual situation. And all the situations which, in addition to COVID, which we Kashmiri especially we are facing here. But I'm afraid. Please allow me. If I'm afraid, if I go on speaking in English, then the immediate audience or my society, they may not be able to understand what I'm going to actually convey to them. So. The problem is that हमारे बच्चे एक तरफ से एक्सेस नहीं है बहुत सारी चीजों की तरफ, एक तरफ से जो होप है यूनिवर्सिटी की जो हमसे चाहते हैं वो बराबर वहीं पर है, लेकिन हमारे जो मीन्स हैं और हमारी जो एक्सेस है वो बहुत कम है. अभी तक हमारे बच्चों में अभी आप देखिए हमारे यूनिवर्सिटीज में जब हमारे बच्चे जाते हैं तो हमारे यहाँ सिस्टम क्या है, hundreds of students, but most of the students they don't have their transport facilities. टाइम पे उनका पहुंचना मुमकिन नहीं होता है. और टीचर स्टूडेंट गैप जो है बदकिस्मती से टीचर स्टूडेंट गैप बढ़, जिस तरह से पेरेंट और उनके बच्चों का गैप बढ़ता जाता है, इसी तरह से हमारे टीचर और स्टूडेंट लैब में बढ़ता है। तो यूनिवर्सिटीज को बच्चों के साथ जो ही उनके इंडक्शन प्रोग्राम्स करने चाहिए, और बच्चों की जो लेवल्स हैं जिन घरों से वो आते हैं उसको बहुत देखना चाहिए। और मेरे ख्याल में यहाँ एजुकेशन को बिल्कुल फ्री करना चाहिए। अभी हमारी जो सिचुएशन है, मैं अभी कश्मीर की भी बात करूंगा, एजुकेशन को टोटली फ्री करना चाहिए। हमारे बच्चों पर उसका बोझ भी नहीं चाहिए। मेरी एक एक्सपीरियंस है, just this year, when we were not going for this COVID lockdown, two students approached me and they asked me for cancellation of admission. The reason was that they didn't have fees. That was the reason. Somehow, the last year, some teacher managed to arrange a good amount for a student who then continued his studies. But this year, a, a female student had to discontinue her studies for many reasons, because they couldn't she couldn't then manage her uh, boarding lodging facilities. That was was there some problem. So such problems the students face, and now thank Allah, that ragging, that tradition has now gone. लेकिन उसका भी बहुत सारा स्ट्रेस पड़ता था स्टूडेंट्स पर। मैं देखता हूँ कि कॉमनली जो बच्चे हैं, जब भी जैसे मैंने आपको अर्ज किया कि बहुत सारे बच्चे हमारे ऐसे हैं, आप देखिए ना किन गाड़ियों से आप आते हैं, उन गाड़ियों की ओवरलोड सिचुएशन हमारी क्या होती है। दूर गांव से बच्चे आकर के यूनिवर्सिटीज में आते हैं। यूनिवर्सिटी में जब वो पढ़ने आते हैं तो उनके पास बहुत सारे गैजेट्स नहीं होते हैं। उधर से जो उनसे मांगा जाता है उसमें टाइम इतना फास्ट रन करता है, उनको इतनी एक्सेस होनी चाहिए बहुत सारी चीजों पर। बहुत सारे स्टूडेंट्स जिनसे मैं बात करता हूँ वो कहते हैं कि हमारे पास लैपटॉप नहीं, हमारे पास वो एंड्रॉयड फोन नहीं, तो हम इन पर इतना डालते हैं कि ये इंटरनेट से आप ये सारी चीजें हासिल कर लो, डाउनलोड कर लो। तो मैं समझता हूँ कि यूनिवर्सिटीज को ये सारी चीजें जरूर लेनी चाहिए। और जो हमारे स्टूडेंट्स होते हैं, पीजी लेवल तक को जनरली स्टूडेंट्स के लिए एक ऐसी लैब होनी चाहिए जहाँ ये सारी चीजें उनको मुहैया होनी चाहिए। फिर स्कॉलरली लेवल पर, रिसर्च स्कॉलर लेवल पर ये सारी चीजें उनको इंडिविजुअली मुहैया होनी चाहिए। और यूनिवर्सिटीज की तरफ से न सिर्फ रिसर्च स्कॉलर्स को स्कॉलरशिप्स मिलनी चाहिए, बल्कि आम पीजी लेवल पर भी और यूजी लेवल पर भी स्टूडेंट्स को स्कॉलरशिप्स मिलनी चाहिए, और वो जनरल होनी चाहिए ताकि वो आगे बढ़े और उनका स्ट्रेस लेवल ना बढ़ जाए।
थैंक यू डॉक्टर साहब। तो फ्रॉम व्हाट आई अंडरस्टैंड, आप क्यूमुलेटिवली हर चीज़ को ले रहे हैं, मतलब इट इज़ इंक्रीमेंटल, एवरीथिंग एड्स टू प्रेशर एंड इवेंचुअली इट बिकम्स सो मच दैट इट बर्स्ट। मैं आपसे ये जानना चाहता था कि universities can have counselors, but not everybody has the resources, say a small school or a small college. So teachers who teach in class, from those people what should be expected? Which, जैसे आपने कहा कि एग्जाम्स होते हैं या टीचिंग का तरीका होता है, स्ट्रेस लेवल होता है, टीचर्स का क्या रोल रहना चाहिए ताकि वो स्टूडेंट्स का ऑलरेडी जो स्टडीज का स्ट्रेस है वो मेंटल स्ट्रेस ना बन जाए?
अभी तो है वो मेंटोरशिप जो है, a teacher has a strong communication with and very close intimation with his students. तो वो शेयर करते हैं अपनी प्रॉब्लम्स टीचर के साथ, लेकिन उसमें टीचर को बहुत जिम्मेदारी के साथ अपने बच्चों के करीब जाना चाहिए, उनकी बातें सुननी चाहिए। हमें, मैं आपको कुछ एग्जांपल्स ऐसी बताऊंगा। खुद क्लासरूम के अंदर जब हमारे क्वेश्चंस को स्टूडेंट पॉजिटिवली रिस्पॉन्ड नहीं करता है, तो यू शुड नॉट जस्ट इंसल्ट द स्टूडेंट इन द क्लास। मोहब्बत के साथ उसको करीब जाना चाहिए, उससे बातें करनी चाहिए, और स्टूडेंट्स के सामने उसको ऐसी एम्बरेसमेंट नहीं होनी चाहिए। स्टूडेंट्स के सामने जहाँ हमारी मिक्सड सोसाइटी होती है, हमारी बच्चियां भी होती हैं और हमारे बच्चे भी होते हैं, वहाँ अगर आप किसी स्टूडेंट्स को इतनी एम्बरेसमेंट उसको हो जाएगी क्लास में, तो वो आगे वो उसको संभाल नहीं पाता है। तो स्टूडेंट को एक बाप की हैसियत से और एक दोस्त की हैसियत से पढ़ाना भी चाहिए, और स्टूडेंट्स के दिलों के अंदर ही मस्ट फाइंड वेज टू पेनिट्रेट इन द हार्ट्स एंड माइंड्स ऑफ द स्टूडेंट्स, एंड जस्ट लाइक ए साइकेट्रिस्ट or psychoanalyst, he should know the background history of his students. क्यों परेशानी है स्टूडेंट्स में। मैंने बहुत सारे बच्चों से पूछा, और जब मैं पढ़ाता हूँ क्लास में तो कभी ऐसी बातें छिड़ जाती हैं क्लास में, तो कुछ बच्चे रोते हैं, लेकिन when we just take them alone और उनसे फिर पूछते हैं तो बहुत सारे बच्चे ऐसे यतीम बच्चे होते हैं, ऑर्फन्स होते हैं, किसी की ज़रूरतें उसकी माँ पूरी करती है, दूसरे के घरों में झाड़ू देकर। तो ये सब तमाम परेशानियाँ उन बच्चों के पीछे लगी हुई हैं, लेकिन हमारे सामने जब वो आते हैं तो हम सबको एक रॉड से देखते हैं, एक ऐनक से देखते हैं। तो इस तरह से now each students needs individual attention. You need to understand their background, you need to understand their limitations. उस तरह से अगर उस्ताद बच्चों के साथ दोस्ती और मोहब्बत और शफकत से पेश आए और कभी कभी अपनी जेब से कुछ पैसा खर्च करके स्टूडेंट्स की परेशानी को दूर करे, तो मेरे ख्याल में ये एक बहुत ही, एक तरफ से मजहबी एतबार से ये अल्लाह ताला की इबादत भी होगी, बहुत बड़ी नेकी भी होगी, सोशल सर्विस भी होगी, और अपनी सोसाइटी को जो रोज बरोज हमारे यहाँ बहुत सारे केसेस हो जाते हैं, उनको जब हम डिक्रीज करने में मददगार बन जाएंगे, तो अल्लाह ताला की तरफ से बहुत बड़ा मौका होगा हमको, दैट वी सर्व द सोसाइटी एट लार्ज.
Thank you, Dr. Saab. And if anybody in the audience is a teacher or somebody who teaches at any level, some very valid points for you to inculcate. For the same question, Mr. Adil, so from a student's point of view, आप क्लासरूम के उस तरफ बैठते हैं, आपकी इंटरेक्शन बाकी स्टूडेंट से ज़्यादा होती है, तो आपको क्या लगता है क्या चीज़ें होनी चाहिए इंस्टीट्यूशन की तरफ से या आपके टीचर की तरफ से, जो स्टूडेंट्स को, जो आज के स्पेशली गिवन कोविड की वजह से या पॉलिटिकल जो टर्मोइल रहा है कश्मीर में प्लस स्टडीज़ वगैरह, उसमें क्या अप्रोच रहना चाहिए टीचर्स का, या आपकी क्या एक्सपेक्टेशंस है या क्या चेंजेस आप रखवाना चाहेंगे?
Okay. Firstly, we all have to understand, and we do understand that there is a problem with a place called Kashmir, yeah, politically and socially, and as part of as far as we're the part of society, there's a societal pressure as well for the students as well as with other people in large. And what can we do as an institution, or beyond the classrooms? First, there should be peer-to-peer interactions, like Dr. Saab was saying, that we should be more friends to the students than being their harsh and strict lecturers or the professors. Because time has changed, this doesn't work in that way, because right now there are a lot of things going in a student's mind or in their life. For example, I'll just tell you that few months, just a month back, the university came up with a notice that you are having the final examinations and you had to deposit the fee. You will not believe, I was receiving hundreds of calls in a day of the students that telling me that we are not in a position to pay right now. Please just convince authority that give us some time. And I approached, because I had only approached the dean of students, Dr. Anisa, that I approached her, and finally she had some meetings with the administration, and finally they released the examination forms and they gave students time. Even I was a part of that committee as well, who has not paid the fee because there were some family issues at that time, but I have done now. And there is everything adds up, from finance, from your travel, from classroom, from your friends, from your family, everything, and adds up to your mental health. And now, as we understand that students are more into their universities or institutions or in their schools, what can we do? We have we have to create a system where we can promote inclusion and belonging. We have to make students feel that you are inclusive, you are a part of this family. We belong to you and you belong to us. We have to promote inclusive and relationships with the students. For example, we have to foster collaborations. We have to create one-on-one interactions. If there's a university, it must be there that there must be a subject on mental health that must be made mandatory for these students to take. Or maybe if it's not the case, then make it as an elective available for them, and take frequent note of the mental illness. You can do a lot of things, make surveys, do something, just make awareness camps in the university, create some clubs that can talk about mental health openly, because there's still stigma in Kashmir that mental health is not of that value. And as Dr. Saba was rightly saying, that we don't parents don't take it seriously. It has to start from home, and that's also an institution. The first institution is home, and then when we come to the universities, because we spend more of the time there, there must be, inclusion, belongingness. We have to promote the relationships with the students, and we have to allow them, autonomy within the subjects, within the chosen curriculum. What you want to do, what you want to do within the limits, of course, that they should not do any other things. And we should, provide always useful information for them, what is right and what is wrong. And one of the most important things that I felt that is lacking in the students, they don't understand that they have a mental illness until it reaches to the extreme stage. Because there is not that how can I say, not an information with the students, that if they want to self assist, how can they assist, and how can they know that am I having any mental illness, am I going towards that direction or not. That must be there, those programs and everything. And yes, there must be importantly a mental health counselor. And yes, I hope I answered the question.
Yes, thank you, Adil. A very important point you said, that self help is important. So my next question is to Dr. Shaheen. I want to ask कि बहुत बार क्या होता है कि हम लोग आजकल एट द ड्रॉप ऑफ अ हैट वी से मुझे डिप्रेशन है, मुझे एंग्जाइटी है, मुझे स्ट्रेस है, ये बहुत बड़े बड़े वर्ड्स हम लोग यूज कर रहे हैं. सो व्हाट इज द डिफरेंस क्या है एक क्लिनिकली डिप्रेस्ड पर्सन के और एक नॉर्मल सैडनेस का जो दौर होता है कि आपको कुछ प्रॉब्लम हो गई एंड यू आर सैड, यू आर फीलिंग लॉस्ट. तो वो एक how does one differentiate between those things कि ये जिंदगी का एक it's a phase of life, and एक clinically depressed या एक clinically imbalanced होना, how does one differentiate?
बहुत शुक्रिया दीपा, वेरी इंटरेस्टिंग क्वेश्चन अगेन. जो हमारी जिंदगी है ये इसमें उतार चढ़ाव होता है, which is part and parcel of life. तो स्पेक्ट्रम होता है कि कब आप सैड फील करते हैं या खुशी महसूस करते हैं, और you are overjoyed, you are excited. These are all very normal responses of the body to certain states that you may be in. तो अगर हम फॉर एग्जांपल bereavement को ले, किसी का कोई फैमिली मेंबर की डेथ हो गई, तो वो कुदरती बात है कि उनके लिए वो एक बहुत ट्रॉमेटिक इवेंट होता है. वो काफी ज्यादा अफसोस करेंगे, they will go through grief, they will be crying. In our culture there's also wailing, and we tend to express our emotions quite readily, and we are very extrovert, for example, when it comes to bereavement or losing a loved one. Even with bereavement, जो कि एक बहुत ही ज़्यादा traumatic situation किसी की ज़िंदगी में होती है, one of the most traumatic situations, even उसमें अगर आपकी ये feelings है कि आप sad हैं या आप anxious feel कर रहे हैं या आपको अफसुर्दगी है या घबराहट हो रही है, even by the terminology of mental illness and by the expertise in mental illness, up to 6 months to feel like that, it's considered normal grief reaction. तो उसके बाद फिर होता है कि जब हम कहें कि अब क्या इस इंसान को मेंटल इलनेस हुई है या नहीं, इनका डायग्नोसिस क्या है. ये मैंने आपको एक एक्सट्रीम एग्जांपल इसलिए दी कि bereavement जो है वो एक बहुत डिफिकल्ट या बहुत एक मुश्किल लॉस होती है किसी की भी जिंदगी में, लेकिन उसमें भी एक फेज होता है जो कि एक नॉर्मल रिएक्शन होती है. अब अगर हम इन जनरल बात करें कि कोई परेशान हो रहा है, someone is feeling anxious, for example, there are upcoming exams or you're going for an interview, it's normal to feel anxious. In fact, sometimes that anxiety will release some hormones in your body, especially adrenaline, which will help you perform better. Similarly, for sports people, before an important match, they may feel a bit anxious, but that may help them perform better. इसी तरह से आपने कहा कि वो कहते हैं मैं डिप्रेस्ड हूँ. हमारे कश्मीर में चेंज ये भी आई है कि हम जो है अपनी जबान भूल गए हैं. अशुवन कशुर करन छु साइन खतर वारिया आसान ना, सो अनयूजुअल चीज. हमारी जो वोकैबुलरी है वो उर्दू इंग्लिश में कन्वर्ट हो गई है, especially in the last 20 years or so. So we pick up terminology which is very easily, again, heard through media, through television, through internet, on these various social platforms like Facebook, Instagram, TikToks, and whatever. So you are picking up these words out of, you are plucking them from the air. मैं depressed हूँ, मैं anxious हूँ, मुझे suicidal feelings आ रही हैं. तो एक वो चीज है कि हम ये टर्मिनोलॉजी बहुत कैजुअली यूज कर रहे हैं. वी मे नॉट नेसेसरीली मीन कि मुझे मेंटल इलनेस है. एक वो है. दूसरा है कि आपने ये मुझे पूछा कि क्या हो सकता है कि व्हेन कैन वी डिफरेंशिएट अच्छा नॉर्मल रिएक्शन और इज इट अ मेंटल इलनेस नाउ. तो मैं आपको कुछ साइंस बताऊंगी जो मेंटल इलनेस के हैं which differentiate from what you may normally experience and you should normally experience. For example, अगर किसी ने एग्जाम में टॉप किया, अगर वो खुश नहीं, अगर वो एक्साइटेड नहीं है, तो वो भी सही नहीं है. That's not appropriate. Similarly, अगर किसी के साथ कोई बुरी चीज हुई है और अगर वो नॉर्मली वैसे रिएक्ट नहीं कर रहा है appropriate to that situation, if the behavior is not appropriate to that, then that's a problem as well. तो अब ये बहुत फाइन लाइन होती है between having these experiences, difficult experiences, distressing experiences, and developing a mental illness. So I'll tell you sort of 5 things about recognizing what is a mental illness. When does this worry, this anxiety become a mental illness? The first one is when it is excessive. तो जैसे आपका एग्जाम हो रहा है, आपको परेशानी हो रही है, आप वरी करें मेरे क्या ये परफॉर्मेंस होगी, मेरे रिजल्ट्स क्या होंगे, बकरा ठीक बकार नहीं ठीक, दैट्स एक्सेप्टेड. बट इफ दिस वरी बिकम्स सच कि आप सो नहीं पा रहे हैं, आप खा नहीं पा रहे हैं, आप बार बार टॉयलेट जा रहे हैं, आपके बिहेवियर्स अब नॉर्मल हो रहे हैं, तो ये एक साइन हो सकता है कि शायद आपको मेंटल इलनेस है. सिमिलरली अगर आपकी उदासी या सैडनेस इतनी ज्यादा है कि आप हर दिन वैसा फील करते हैं कंटिन्यूअसली फॉर एटलीस्ट अ कपल ऑफ वीक्स, कि आप पूरे टाइम उदास हैं, आप पूरे टाइम डिप्रेस फील कर रहे हैं कॉन्स्टेंटली, एंड इट्स अफेक्टिंग योर personal life, if you're working, your work life, your social life, your relationships, then it tips into a mental illness. Similarly, अगर आपके extreme mood changes होते हैं, by extreme I mean that it is completely inappropriate. आप पूरे रात दिन रोते ही जाते हैं, या पूरे रात दिन जो है आपका behavior aggressive है, आप चिल्लाते हैं या आप चीजें तोड़ते हैं, that becomes extreme. That's the third thing. चौथा जो चीज है, आप socially withdraw होते हैं. You don't interact with your family, you shut yourself in a room. लेकिन उसमें भी आपने देखना है कि बच्चा अपने आप को कमरे में बंद करके चैट तो नहीं कर रहा है, खुश है, अपने फ्रेंड्स के साथ बातें कर रहा है, या sometimes it could be that they are watching movies, they are enjoying. So even when they are shutting themselves away, it has to be in the context that they are shutting themselves away because they are feeling so depressed, they don't want to see anyone. They are spending all the time in bed. They are not eating. Or the next thing is you will see that there is dramatic change from their normal behavior. और वो उनके खाने में हो सकता है, क्योंकि हम सबका एक जो है ना बेस लाइन होता है. फॉर एग्जाम्पल मैं आपको अपनी मिसाल दूं, I may be a light eater, so my meals are smaller in portion. लेकिन अगर मैं बिल्कुल खाना बंद कर दूं तो वो मेरे लिए चेंज है. इसी तरह अगर कोई बिल्कुल कम खाना खाता है and they start eating excessively, then it could be a sign of mental illness. Similar is with sleep. We all have a sleeping pattern. कोई जो है रोज सुबह 8 बजे उठता है, अगर वो 5 बजे उठने लगा रेगुलरली, वो परेशान हो रहा है, तो that needs to be looked into कि ये क्या वजह है. और फिर lastly, unusual feelings. Humachumenis various muskehawanan, paranoia, this person is against me. And again, that has to be without any evidence. So it's a false belief. अगर वो हकीकत में हो रहा है तो वो mental illness नहीं है. But if it's not happening in reality, then it's a sign of mental illness. So just to summarize for the benefit of the audience, If you are excessively worrying, if you are excessively anxious or paranoid, that's one. If there is long-lasting sadness or irritability or extreme mood changes, if you're socially withdrawn, if there are dramatic changes in your behavior, whether it's eating, sleeping, or you have abnormal feelings, and lastly, if you are feeling hopeless, if you are feeling suicidal constantly, ये नहीं है कि मैं suicidal feel कर रहा हूँ, you have to explore what does that mean. It has to be more than I'm just feeling suicidal or I'm just feeling depressed. Now, very briefly, just to tell you, मैं depressed हूँ और depression as a mental illness में क्या फर्क है? Depression as a mental illness, as I said, you have to constantly feel low in mood for at least 2 weeks, और हर दिन आप low होने चाहिए mood में, और बाकी चीजें affected होने चाहिए, आपका sleeping pattern, your eating, you may be feeling, hopeless, you may be getting thoughts that you don't want to live, you may be getting socially withdrawn, so you have to at least have 2 or 3 of these features for long enough a period of time. And most importantly, it should affect your normal functioning. आपका काम या आपकी relationships या आपकी पढ़ाई उन पे असर होना चाहिए. So it can't just be, something plucked out of the air कि मैं depressed हूँ. I hope I answered your question, Deba.
Yeah, thank you, Dr. Shaheen. Moving on, Kashmir, in Kashmir, we do not have a concept of, speaking to shrinks or psychiatrists, which is a norm in the West. Basically, venting it all out to somebody and speaking to somebody who might not judge you. Given that context, a part of it is because, the mental health issue is very stigmatized over here. So what I wanted to ask you is, how can we destigmatize it? How can we normalize it? How can we normalize it as, as somebody falling, having some, as a cold or something? And if that at all is possible.
I think it has changed, Reeb. It's changing because the number of patients that are seeking help from the Institute of National Mental Illness there, the number of patients that go to the private clinics of psychiatrists, those that are seeing counselors, I think it has increased. So it has changed, but obviously there is still a largely stigma attached. And to be honest, even in the West, it's not entirely stigma-free. So people will sometimes, especially South Asian people or Afro-Caribbeans living in the West, they will still have a lot of reservations in seeking help. So in order to overcome this lack of engagement or lack of seeking help, the first thing that you need to do is to create awareness. And you have to create it through every medium that's possible, whether it's print media, television, radio, internet. You have to normalize that as important as physical illness is your mental illness and mental well-being. And we do not necessarily, in terms of awareness, need to focus on mental illness. I think we should shift the focus to mental well-being, and then that way there will be more acceptance that it is something that we need to take care of as much as our physical health. And that will also shift the thinking, and it may help in destigmatizing the whole concept of mental illness. Because we have to remember that before any individual gets to the stage where they then are having a full-fledged mental illness, they go through phases. So it's about catching it early, and that can only be done, one, if there is awareness, but also if there are platforms, as we've already mentioned in this program, चाहे वो स्कूलों में आप mental illness या mental awareness के webinar शुरू करें, कोई short lecture शुरू करें, or make it part of the curriculum, but also have someone available in schools, in universities, in these big tuition centers that people can approach, that they can go to easily. और दूसरा यहाँ के भी स्कूलों में ये होता है कि ये नहीं है काउंसलर कोई बैठा और बच्चे बहुत आराम से उसके पास चल के जाते हैं. It's not as easy and simple here as well. It's done in confidence, so you have systems in place that you in confidence will seek help, and it doesn't become, another sort of public issue that everyone knows about it. That's another reason why people don't seek help, because they will say कि अब सबको पता चल जाएगा, अब मैं क्या करूं. So you have to also create systems where people can confide in with confidence. जो दूसरी चीज है, हिस्टोरिकली क्या होता था जब मेंटल इलनेस होती थी, तो हर एक कल्चर में, चाहे आप वेस्ट को लें या ईस्ट को, हम अपने बुजुर्ग या अपने प्रीस्ट, मौलवी, क्रिश्चियनिटी में तो प्रीस्ट के पास वो जाते हैं. आपने शायद फिल्मों में भी देखा होगा, when they wanted to confess if they had say committed a sin or done something bad, they would go and speak to the priest. Similarly, we would go to people that we trusted with these problems. And I think we need to revisit these avenues as well, क्योंकि ये भी एक जरिया है जिससे कि आप एक तो कॉन्फिडेंस बिल्ड कर सकते हैं अपने बच्चों में, लेकिन एक alternate means of coping आपको मिलता है. You're one of the protective factors that we have in the West for people like myself, but others who practice faith. Our faith is a protective factor against mental illness, or it's a protective factor against in people who are suicidal. They don't commit suicide, and in the West, if I ask a Roman Catholic, they will say, I won't do it because in my faith I'm going to go to hell. So that stops them. So we have to revisit those avenues as well. And I think the administration there, they have a huge responsibility of ensuring that there are some safety systems available for young people who need help or are wanting to seek help. They can go and see them. There's a couple of questions that are related to it that I saw in the chat. I think one was from Bhatt Gilani, and he wanted to know, how does someone acquire a mental illness? So just to briefly answer that, you can have a genetic predisposition. So some of us, like, for example, people in South Asia, they carry a gene by which they have got more predisposition to developing diabetes. Similarly, there are some psychiatric illnesses, especially the psychotic illnesses like schizophrenia, but also some depressive illnesses like bipolar affective disorder or depression in general, that you can have a familial predisposition, if not a gene, to get the mental illness. The second way by which you get is by your experiences. So if you've been subjected to trauma, be it childhood abuse, be it a traumatic experience, be it your experience in life, that can predispose you to mental illness as well. And the second question was from Ubaid, and he was saying, is it possible to achieve well-being without any religious intervention? And specifically, he was asking about Islam. And the answer to that is yes, it is possible. But as I mentioned, as many protective factors as you will have, your resilience will be better. You will depend and fall on things that are more constructive and not destructive, religion being one of them, or you can call it faith, or you can really name it anything. But it is possible that you could still be able to achieve your well-being without that. But then it depends on really what you think about well-being or what you call is well-being. For some, without their faith, well-being is incomplete. For some, it doesn't matter. So I think it's an individual preference and an individual position on that one. Thank you. Diba, did I answer everything in that question?
Yes, you did. Thank you, ma'am, for the answer. Dr. Nazir, I think there has been a glitch. So I would like to ask Adil कि आपको पता है कि आजकल आपके यूथ में क्या प्रॉब्लम हो रही है. हम लोग ने इस डिस्कशन में मेनली फाइनेंशियल एस्पेक्ट को लिया, but there are many other issues which are swept below the carpet. For example, relationships, for example, peer pressure, there's social media, जिनको हम एक्नॉलेज नहीं करते, जिनको हमें ये लगता है कि ये क्या फजूल सी बात है, इस पे क्या डिप्रेस होना. तो उन चीज़ों को भी हाईलाइट करना है. एंड व्हाट डू यू थिंक के what if somebody comes to you, a friend, what are the suggestions, you being one of the the youth, what are the suggestions that you would like to give to anybody, a friend, like a friend who is dealing with such problems?
Thank you very much. So yes, you spoke quite rightly. There is this serious concern about you that if it's now nowadays a norm. One friend can talk with any other friend and tell him about the mental situation or any other problem. But what most important is that you are not qualified enough to diagnose or to ask him anything. So if a person comes to me and I feel that there is something terribly going wrong, I firstly ask him that you must consult somebody who is in this. And alhamdulillah, there are some people with whom I am in touch. Already conducted 2 sessions on mental health, so I divert those students or those youth to the persons who are qualified to do the things on their behalf. And importantly, yes, there are some factors that can help, like eating healthy, like getting a good hours of sleep, like being active, building a strong social support. It doesn't matter where it is, in university or in a family or a friends. Social support will help them a lot. If they are positive in their lives, they eradicate negativity. That will help them to just cope up with this. Engaging in their hobbies, obviously, so is one of the great things that they can do. For example, if you take a person who is mentally depressed and goes to the section of that you called drug abuse, we can engage him in such an activity that he gets rid of it. Like we can put it in hiking, put in mountaineering, put in somebody else. you know like there are a lot of things that can be done, and most importantly, the person should should disconnect him or herself from the negativity. And yes, a professional help is always welcome, and that is the most important. And yes, there must be positive relationships. It doesn't matter it is with your family, with your father, or whom you love, or it's with your teacher or your friend. Positive relationships will help a lot. Self of belongingness will help a lot. And yes, keeping the person motivated will also bring it will also bring them to take an extra mile and to help them in coming over the experience that they face. I hope that answers your question.
Yeah, thank you, Adil. Could you share some resources? Like you said, you divert them to some resources. So maybe this time or in the comment section, we would really like to know what are those sources and how we can connect with them.
There is there's a section that we call imhans. If you search it, that there is the people we have done you know a mental health session. That's a separate section in society instead of mental healthness. You can just search it on the Google imhans Srinagar. You can get all the details out there if you want to get professional help, and there are people who can get to you.
Also, I
And
would
yes,
like to say that uh, we at in IITs there are separate counselors who are for this, or there's an app called Your Dost, and you can like log in there, make an account, and you can talk to experts there. um, I think Dr. Nazir is not able to connect to us. Um uh, okay, so I'll quickly ask Dr. Shaheen once again, if you could give us like five important life lessons that help the children as well as the youth to to overcome all the problems and depression, to have a healthy lifestyle. Also, we all know that we have to exercise, we have to eat food well, we have to do these are, we know all the do's and don'ts, but how do we keep motivated to do those things?
So, Deepa, the first thing we really need to do is that we need to develop good emotional connections. So, that starts with your family. You need to sort of have that environment in your home where there is trust and there is confidence in one another. We give our children that secure foundation, a secure base where they will trust you, where they will know they are valued, and they will then emotionally, connect with you. Um, there's also something that you need to teach them, which is called teaching self-care, and you already touched upon a couple of those things, which is, to have a routine, to be exercising regularly, to having a healthy diet. But more important than that is also for them to realize, what is their potential, what are their passions, what do they like, so they can spend some time and incorporate that into their daily routine of what they want to do. So you basically need to teach them how to look after themselves. The other thing is learning skills. So skills that you would be still able to function and carry on even if your parents weren't there. For example, learning to cook, learning to wash your own clothes, ironing, getting things ready. So very, very simple, basic things. The other thing that also helps in building resilience is something, that's called self-discovery. So you kind of almost uh, get to learn your own self. You accept change, you accept your shortcomings, and you focus more on your positives and your strengths. And linked with this is goal setting. So in terms of goal setting, it could be, just a weekly goal setting or even a daily goal setting that today I'll do this. Or it can be, in the longer run, this is my goal where I want to be in a year's time. And it doesn't necessarily have to be academic. और भी चीजें हो सकती है, I want to do well in sports, I want to be here, or I want to, write. You have to encourage your children in different ways. क्योंकि सबकी जो है strength different होती है, हर एक की weakness different होती है. And everyone has to be treated as an individual. You cannot fit everyone into the same box के healthy खाओ, exercise करो, पढ़ो, time पे so. It doesn't really quite work like that, but that's what you have to work towards. The other thing that really is very, very important for your mental well-being is, and also for being resilient, or the ability to cope with life, is by helping others. So find a purpose. It can be a small thing. I'll help my dad water the plants, or it can be bigger goals. I'll be part of a volunteering group to help the poor people, or I'm just sort of giving generic examples. But when you teach children or youth to help others, it gives them a lot of contentment and satisfaction, and it builds resilience. And most importantly, I think in today's day and age, where, as I mentioned at the beginning, you have access to a lot of information, it's also about self-regulation. How much time do I, for example, spend on my smartphone? What do I do with my time, with my 24 hours? How do I productively spend time? So these are sort of, little tidbits that every one of us in some varying degrees should adapt. और सबसे जो इम्पोर्टेंट बात है, अपने बच्चों का आप ख्याल रखें, अपने यूथ का ख्याल रखें. Try and understand, what are the difficulties they are posing, and then try and see how can we help them. And help starts at individual levels, चाहे वो आपके friends हैं, teachers हैं, आपकी family है. Then it moves on to the community level. For example, schools, your colleges, your places of work. Help can come and support can come from these various other places as well. I know it's not as structured in terms of well-being of employees, for example, is a concept that you don't have in the East, whereas in the West, there's a lot of focus on work-life balance, on employee well-being, on employee rights, on destigmatizing things, on equality, on doing away with discrimination. Similarly, then we have to look to other avenues, जैसे non-governmental organizations है वहाँ पे, या जो government की organizations हैं, religious organizations हमारी हैं, वो सब भी कैसे काम कर सकते हैं together, so that we are there, to build a happier, healthier community, and that comprises of both children, youth and the elderly. So I work in the National Health Service here, and one of the mottos here that we have is that we say there is no health without mental health. And if we break it down, what it means is that we try and work towards a positive state of mind. We work towards everyone feeling safe, being able to cope, with the ups and downs of life, and also having that sense of connection with other people and the community, that we are there for each other and there is someone for me. Thank you.
Thank you, Dr. Shaheen. So, we've all often heard, the adage that a sound mind in a sound body, but I think it is not wrong to say that a sound body comes with a sound mind. Uh, Given that there has been, unfortunately, a lot of recent suicides have come to fore, especially in our valley. And I would like to ask Dr. Shaheen that what should have been, or what should be the attitude of the family, of the immediate friends of the person who has suicidal thoughts, given that mental health as such is not an individual's responsibility to set it right. I think it's collectively the responsibility of the family, the society, to help those people who require us, who need us at that time, to talk to them and to understand and trying to help them in whatever ways we can. So what would be your message to people who can actually help and who are in close proximity to those people who have suicidal thoughts, or are considering ending their lives?
Yeah, it's quite a concern to me, obviously, as a professional, but also, as a person, especially this trend of increasing suicides in Kashmir, especially amongst the youth. So again, what I would like to say, Arib, suicides don't just happen. There is a build-up to someone taking the extreme step of wanting to take their own life. And usually there will either be an underlying mental illness, or either known or unknown, or there may be, a range of other symptoms. So, for example, some children may be struggling emotionally. They may not necessarily have a formal mental health diagnosis. Some children may be resorting to things like, coping in dysfunctional ways, like taking illicit drugs, or some youth may be going through different, traumatic phase of their life where there is not necessarily a known mental illness. But usually suicide is linked with people that have an underlying mental illness, but not everyone that attempts to self-harm or commit suicide has a mental illness. So these are two things that we need to bear in mind. Now, in terms of recognizing the signs, so usually there are predisposing factors. So predisposing factors is something that makes you more prone or susceptible to suicide. One of them, as I said, is a known mental illness if you have one. You can also have a severe physical illness or a disability or chronic pain that can push you to not wanting to live. Similarly, there could be, childhood traumas or recent traumas which you can't bear. Things like losing a parent, losing a loved one, losing a friend. These can be all predisposing factors. So you become, at risk, and that's sort of predisposing factor. Then there are perpetuating factors. So perpetuating factors are things that are constantly there. So say a young person who is unemployed, he has financial worries. So it's always there in the background. So it perpetuates the problem. Similarly, there could be someone, who is struggling, say, with an eating disorder, and it's not going away. So it perpetuates, and it's always there. Then there is a precipitating factor. So something triggers it. Something changes. So they may have predisposing factors and perpetuating factors in the background, but then something brings them to a point where they are contemplating about suicide. They are thinking about it. They get thoughts of wanting to harm themselves. They make plans. They, have a strong intention and an inclination. And usually at that stage, there is grading. So you can have mild symptoms where there's a fleeting thought, but you can, do away with it. You can distract yourself, or it's coming and going, or it's constantly there, and the urge is such that you are making plans. I'm going to go to the bridge tomorrow and I'll jump. So that's very serious. So the signs to pick up is again going back to what I said about mental illness. Please observe for changes in behavior in your children, in your youth, in your friends, in your students, in people around you. Usually there are changes that either are obvious or you have to explore. One of them is, they are depressed, they are not socially as engaging as they may have been before, or there are some changes in their behavior, and something is telling you it's not right. The second important thing always is to ask. If you don't ask, you won't know. So we are very hesitant in asking and having open, conversation discussions about them. So if you are, for example, if I was a teacher and I saw one of my students is feeling a bit low, I would take them aside. I would ask them, how are you feeling? How is everything? And don't hesitate to ask that direct question. Tamachi khudkushi, if you find the person, that desperate, to get Chuksonchan, and many a times they will actually be relieved that someone has asked them. But unfortunately, again, we don't have those conversations because we don't have that much awareness or that much courage ourselves. Because the problem is, if someone did tell you, oh, Mich Khodkushin Khayaliwan, what are you going to do with that then? You need to have some system then that you would send a particular person who's told you this too. You shouldn't be caught in a situation where you knew you weren't able to do anything, and unfortunately still the sad incident happened. Apart from this, if someone is feeling suicidal, you have to try and minimize what they can access. So for things like, if it's a village, do they have easy access to pesticides? Take them away from them. If they are, say, living in the city, do they have access to medication? How much medication can you buy? Again, in Kashmir, it's very difficult because you can pretty much buy everything over the counter. I can't even buy a cough syrup if I wished in the West to buy over the counter, not to talk about, drugs for blood pressure or anything like that. I just won't be able to. But irrespective of that, people here can store paracetamol, which they can buy, or ibuprofen in large quantities and take an overdose. So you have to look for things that your youth may be able to avail. The third thing which I have requested the administration actually through one of my posts on Twitter is that we should have some sort of a guard mechanism on these bridges, because the recent incidents, especially amongst females, but also some males, is this jumping over the bridges into the river and they drown. So I think as a society, we have a lot of responsibility to ensure that our young people are safe. And we have to try and maximize those safety nets. Unfortunately, there will be a very small proportion, hopefully, that may still end up committing suicide. But what is happening now is that it seems to be getting out of proportion. The other thing through your program that I want to request is please don't dramatize and sensationalize these suicides. It becomes the news of the town. It's on every newspaper, the means, the person, who did it, how they did it, and all the rest of it. So there is really no privacy or dignity even given to the person, who is unfortunately taken their life and ended up in a tragedy. So I think we have to have some responsibility and sensitivity around these things as well, and not give them unnecessary sort of dramatic, platform either. But at the same time, it has to be a fine balance between creating that awareness, creating those systems that these young people can avail. So in response to that, but also during COVID, the doctors in Kashmir and predominantly overseas doctors across America, UK, UAE, and other places, they are part of this dial a doctor helpline. So the number for that is 1800-889-2729. And this is available 24/7. So you can speak to someone. And there are mental health doctors and psychiatrists on the rota as well. that will be able to, help you and direct you to the right system, whether it's a clinic or a counselor or a psychiatrist or whoever it is. So it's again, it starts from awareness. It starts from creating systems. You always have to give hope to people who are suicidal. You have to, and there is always hope. There are some protective factors, and we need to strengthen those. As I said, for some people it may be faiths, for some people it may be their parents, for some people it may be a pet. They wouldn't do anything to leave their family members behind. So there's a range of things that we have to then strengthen and minimize the factors that actually will be causing a risk. And for those young people who are using illicit drugs and substances, I request you that the overdoses are lethal. So please, even if you are misusing drugs, you will know what is a safe dose for you. Don't go over it. Seek help because it can be fatal. You can end up killing yourself by an accidental overdose, if not an intentional. So please be careful. Thank you.
Thank you, Dr. Shaheen. Thank you, Adil, for joining us. And unfortunately, Dr. Nazir could not rejoin due to some technicalities. And now we would be concluding. And in the concluding remarks, I would want to tell everybody that we all are fighting our own individual battles. We all have our own issues and problems, but that does not mean it's the end of the world. Speak to somebody you want, speak to somebody you can confide in, and if at all you require, speak to me or anybody at the Alumni Council. We are always free to talk to you, and we'll take out the time in whatever way we can. We'll help you out. And remember, since Alhamdulillah we're all Muslims, and we derive our spiritual fulfillment from the Quran. The Quran literally says, Allah Ta'ala literally says, don't be sad, don't give up, and with every hardship comes ease. And with those words, I would like to conclude today's discussion. Thank you, everybody, for joining us and taking out the time. Fi amanillah, take care, and have a great weekend ahead.
Thank you.